how an OBGYN missed a patient's breast cancer. How did this happen? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law here in the state of Maryland. And I would like to talk with you about a case study that I was reviewing. And in this particular case, what happened was a young lady went to her OBGYN complaining of a lump in her breast. The doctor did a physical examination and also noted the lump and noted in the medical records that a flat cystic nodule existed, but told the patient, you know what, do not worry about this. This is because of your pregnancy. Everything is going to be okay. Well, throughout the patient's pregnancy, she still feels the lump. The lump is still there. So she talks to 2 other doctors at her clinic about this lump. And both of these doctors tell her, or they assure her, that this is because of your pregnancy. Nothing out of the ordinary is here. Don't worry about it. Well, after we fast forward further into time, and the young lady, she has her baby, and she notices that the lump is still there. And she's really concerned at this point because she just thinks that something is wrong. She doesn't feel right. So she sets up an appointment with her family doctor, and the family doctor does a physical examination of her and determines that there is a lump there. The lump is still there. Because of the amount of time that had passed from when she first discovered the lump to the family doctor discovering the lump, about 1.5 years, almost 2 years had passed at that point, the family doctor says, we need to get a biopsy done. So they go and they have a biopsy done, and the biopsy comes back and shows that the lump was cancerous. But by this time, the cancer had moved into her lymph nodes, it had spread to her brain and into her abdominal area. When the experts took a look at this, they all concluded that a biopsy should have been done at the first, when the OBGYN discovered the lump and the size of it and things of that nature. When these experts went back and looked at the medical records, they said that the OBGYN should have had her to go out and have a biopsy done. So why have I taken the time to explain this to you today? Well, because you may be watching this video right now and you're wondering, was your cancer misdiagnosed? You may be sitting here thinking, should your doctors have sent you out for a biopsy earlier because of a lump in your breast? Well, if you have these questions and you have these concerns, this is what I invite you to do. Go ahead and pick up the phone and give me a call. It costs you absolutely nothing to do that. I can be reached at 301-850-4832. Or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer medical malpractice questions like yours all the time, and I will be glad to listen to your story. If you're like a lot of people who contact us, you are more than likely confused about the process. You may be worried about things. What's going on? How do I get through a medical malpractice case in Maryland? Go ahead and call me. Because by calling me and allowing me to talk and explain to you the process, that will go a long way in helping you decrease the amount of worry and concern that you may have regarding a possible medical malpractice case here in Maryland. All right, guys, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.